Dale, my first question is cognitive decline reversible?
Absolutely. And we've been told time and time again that there's nothing you can do, there's no prevention, there's no reversal, and there's no delay. And in fact, that has turned out not to be the case. And we worked on this for over 30 years. I had a laboratory and studied the mechanisms of neurodegeneration. So we wanted to understand, why are cells dying? Why are brain cells lost in these various neurodegenerative diseases, such as Alzheimer's and Parkinson's? And what we found was very interesting, that if you look at Alzheimer's, it is very much about a balance between the ability of your brain to make and keep synapses, which is going on all the time. You're learning new things, remembering new things. And on the other hand, pulling back, which is essentially related to forgetting. We're all actively forgetting the seventh song that played on the radio on the way to work yesterday. So there's a beautiful balance. And people who are starting to develop cognitive decline are on the wrong side of that balance. The pulling back is now greater than the going forward and making these steps. So when we treat people, we do all the things that increase the production and maintenance of synapses after evaluating what are the contributors, and then we reduce all the things that are pulling back. And I should point out, all of the approaches in the past have predetermined a treatment. So they just say, okay, BNS, if you're having trouble with your brain, we're going to give you drug X, without knowing what's actually causing it. So what we're doing that's different than anyone before is we look at many, many different variables that look at what actually drives this. So BNS, do you have insulin resistance? Do you have specific toxins, biotoxins, organic toxins, metallotoxins? Do you have specific pathogens? Do you have herpes simplex 1 as an example, which is one of the many that increase your risk? Then we want to tailor the treatment in a personalized, precision medicine way to the things that are actually doing this. And I should say, because of you probably have a lot of young listeners, it's important to point out that we've thought of this disease as the disease of older age, 60s, 70s, 80s, but the reality is it starts even 20 years earlier. So this is really a disease 30s, 40s, 50s that's playing out. We get a diagnosis late, but there are things to be done when you're relatively young that can be extremely helpful in terms of reducing the global burden of dementia.
Thank you, Dale, for the clear explanation.
Yeah, subscribe to BNS Goku Great.